Welcome to Laurell Black, one of my key, our program's key partners right now in enrichment and developing students. And I think they have a most unusual program. Hi, Laurell.
Good morning, Deacon Wilson. It's a pleasure to see you again. We've kind of been out of touch with each other for the past couple of years because of the COVID pandemic, but I'm glad to see you even virtually.
It's wonderful. We'll get together real soon, as you know.
Look forward to it. Yes, sir.
You guys have some great programs there. Why don't you talk about what your position is, kind of what you do? And I've talked to people in the community, they know who you are, and you're almost like an ambassador. But how do you see yourself? What's your title? Go ahead.
Well, thank you. And I appreciate the opportunity to reach out to you and those in your sphere of influence. My name is Laurell Black. I am the outreach manager at Charles R. Drew University of Medicine and Science. And in that capacity, my job is to, I guess, unhide this hidden gem called Charles Drew University. We've been in the community since 1966, focused solely on health careers and trying to serve traditionally under-resourced and underserved communities. So unlike other institutions, we're an historically Black graduate institution, a Hispanic servant institution, focused solely on health careers and keeping our families and our communities healthy. We have 3 schools and our colleges that do that. We have a College of Medicine, we have a College of Science and Health, and we have a School of Nursing. And within that capacity, we have graduated and put out in the workforce thousands of healthcare practitioners to come back and serve in those traditionally underrepresented and underserved communities.
Mm. Mm. I knew that stuff, and I'm just that you exist there right at the cusp of those 2 freeways is amazing. Did I hear you say you're officially a Hispanic serving school too?
Yes, historically Black graduate institution and Hispanic serving institution. And I think one of the only ones, at least in California, and one of the few probably in the nation.
That's what I was thinking about that. I was thinking that.
Yes,
Talk
sir.
about, let's talk first about the program I think people should know more about, given the extreme difficulty, and we make things so hard educationally sometimes. And you guys just boil stuff down. I'm like, oh, it's like, oh, okay. Could you talk about the 3-year or the nursing program as you see it? Right? I don't know what you call it these days, but how does the RN program work? Talk about that a little, because I know that students going to 4-year, they give up on it. And I'm like, oh, that's one less nurse. These are Black and brown students, Laurell. What you got there in terms of that? What would you say about nursing?
Well, our Bachelor of Science in Nursing program, it's relatively new, about 2 years old now. And as you're suggesting, there is a dearth of nursing professionals in our communities. And we're trying to fill that void to the best of our ability. There are those community colleges, and in all due respect, that do have an associate degree in nursing program. And sometimes, in order to get into those programs, students will have to do 2 years of prerequisites and then 2 years in the program. They're spending maybe 4 years or 5 to get an associate degree in nursing. We're suggesting if you're going to spend 4 years, do 4 years with us, get a Bachelor of Science in Nursing. A study was done and found that nurses with that Bachelor of Science in Nursing degree, their patients have better health outcomes. And because of that, hospitals and clinics want their nurses to have that Bachelor of Science in Nursing degree.
Yeah, the insurance companies tell them that.
Yeah, okay, beautiful. Beautiful. And we're trying to fill that void. And of course, the more valued you are as a healthcare practitioner, then the better you're compensated. So not only are you able to assist the patients that you work with, you're also able to carve out a different standard of living for yourself and your family, which is important to us as well.
Wow. Yeah. How does that work for if a senior? A lot of these seniors, they're coming out, they want to go to these expensive private colleges and get a BS. You could spend thousands of dollars, and then fortunately they don't get in, or their parents figure out it costs a lot. How would it work for that 12th grader? I think I have one that's in your program now, but how would it work for them? How does that work? You apply, or what do you take me as a 12th grader through that? How do I become a nurse? What do I expect to see and do? Go ahead.
Yes, you would actually send to us your unofficial transcripts. you would want to have some of your science courses in high school. And we do accept students coming straight out of high school into our Bachelor of Science in Nursing program. And you do your 4 years. And with that, you'll also have some clinical work that you'll be doing in the hospitals and clinics in the area, and your lecture work and the classroom. In terms of cost, people hear, okay, well, Charles R. University is a small private school. And anytime people hear private school, for some reason, their mind goes to, it's far too expensive for me to attend. Well, our tuition is comparable to some of our local Cal State schools and definitely the UC schools. So
I
we
saw
want,
that.
yeah, we want to make sure that you all know that we are affordable. We're right in the backyard, as you suggest. We're right off of the 105 freeway, truly between the 710 freeway and the 110 freeway. So we're relatively close to downtown Los Angeles, the airport. So for those of us in our area, it's easy to get to Charles University.
Nice. And what are some other programs? Like then you have the class of students that's gone to 2-year college and is kind of drifting in their career and might want to get involved in something health related. And
Right.
maybe not want to be a nurse or a doctor, but just want to get in that field. What types of certification programs and then degree programs? I know you got a lot of them. Just hit the ones that are most popular and important to you. I know I probably ask you to do a lot here, but go ahead.
Okay, well, we do have at the associate degree level, and it's really unique at our university. We have from an associate degree program in radiologic technology all the way up to a medical program. So students can get
Whoa,
either an associate degree or an MD degree from Charles University, and those programs in between, those degrees and our certificates in between there. Our associate degree in radiologic technology is a 2-year program. Students will have to have a couple of prerequisites: medical terminology and anatomy and physiology, and of course, for those students transferring in from a community college, probably some of their general education courses.
that's right.
You'll be able to get in the program. We accept about 40 students into that program and make a pretty good living. It prepares you to take the AART licensing exam. And after completing that exam, you're making about $60,000 off of a 2-year degree, which is decent as a medical technologist.
I like that part. Go ahead.
Huh? Exactly. And of course, that's your basic license. The more modalities one earns, they can go into mammography, they can go into MRI, they can go into nuclear medicine. The more modalities one has in medical imaging, of course, the better they're going to be compensated, making up to $80,000, $90,000 per year, with that 2-year degree plus those other modalities. In addition, for those students who are saying, okay, well, I want to work with my people. I don't necessarily want to be in the hospital setting. We have a public health program. Our public health is serving our communities, making sure our communities are healthy, not just on an individual basis, but on a group level. Also, we have a psychology program. Our psychology program works for
Getting the
those,
mental health stuff.
yeah, mental health, exactly. So mental health.
It's very
So we have
important.
substance abuse as well as um, mental health challenges. Excuse me.
Mhm.
And that's what we're trying to focus on. The mental health concept is something that is overlooked in our communities. A lot of folks are depressed, they're distressed, they're going through things, they don't know who to turn to. So we're trying to make sure that they know that there's a conduit in terms of our mental health practices. And of course, substance abuse. We hear these kids, unfortunately, dying from fentanyl overdose and these other overdoses. And we want to make
Yeah, I was
sure that
thinking
we're
about
addressing
y'all the
those.
other day when I was hearing that. Yeah.
Yeah, and that's what we do is we want to make sure that not just our physical health, but our mental, emotional health is being taken care of as well. Um, for those who may have a degree, a bachelor's degree in some other field,
Yeah,
we have,
talk about that.
yeah, we have an entry-level master's degree in nursing. So with that program, a student does not have to have any background in nursing. They would have to fulfill the requirements, about 8 or 9 requirements to get
Right.
into
I
the
saw that.
program.
Yes.
But they would leave that program with a Master of Science in Nursing and their RN license. After working for 1 year with their RN license, then they can apply for our nurse practitioner or nurse practitioner psych program. And we also last year added a doctorate of nursing practice. So
Oh,
not only do
I
we
missed
have
that.
right a medical school where you can become an MD, we have a doctorate of nursing practice, which is new to our
So
university. So we're
somebody
trying
who
to,
has a master's in nursing could go to that, maybe?
yeah,
He has a
yes, of
master's.
course,
Okay, not to
yeah,
go back and spend, as you know, up $100,000 to get a doctorate.
Right.
$120,000 is crazy, man.
It really is.
Yeah.
But the work one will be able to do with that doctorate program in terms of serving our community underserved residents would be phenomenal. And we're trying to encourage folks to do that. And speaking of our medical school, last month, our medical school had kind of severed its ties from its original standing. We were at once working in coordination with UCLA, where students would do the first 2 years of medical
I
school
remember
at
that.
UCLA. Right. And the last two is us, and get a dual degree from both UCLA and Charles Drew University.
Correct.
Now we have a standalone medical school. The
Oh,
previous,
when did that start? I'm very glad of that for a lot of reasons. We can talk
right.
about it offline.
Okay, yeah, please, I appreciate that. The previous program allowed up to 28 students in the program. Our program will allow up to 60, which
Which
will
could have
double
them
the
out.
number
I
of
was going to
students.
ask you, can you have more? Yeah.
Right, yeah, double the number of students that we're going to be putting out into the medical field, again, to try and serve our traditionally underrepresented and under-resourced communities. For those who are thinking about medical school, say, okay, well, that's a lot of schooling. We have a physician assistant program at the master's degree level.
I
That's
saw
a
that.
27-month program. And with that, a person can do the operation, open up their own clinic, just under the license of an MD. And we have about 26 students, about 3,500 people applied to that program, very competitive program. But we're trying to get, especially males into the program, Black males into the program.
Good
And
for you.
also, yes, sir, folks within our communities, people from all across the country are trying to get into our program. We're trying to serve our
Whoa. How
community.
about that?
Yeah, we're trying to make sure that folks within our community have access to all of our programs, and that one in particular.
Yeah, I would guess there really be a real shortage of Black males doing a lot of these programs anyway, especially
Right.
the nurse, the physician assistant. Hey, look,
Physicians and nursing as well.
yeah, yeah. Oh, yeah, right. That's right. Obviously.
Right.
Yeah, when I went and got my, I think he called it a colonoscopy. I don't know.
Uh-huh.
You'll be
Yeah.
interested to know I was hard to put under, so I stayed awake the whole time.
Wow.
Anyway, the two guys who were working with me, one of them was a Charles Drew graduate,
Nice.
and he's talked to me about his program while he's working on me. That's pretty
Nice.
cool. That was a pretty cool experience. That
That's beautiful.
is
That's
a
a good
Charles Drew
testament.
graduate. I'm like, wow. So yeah, you're right. You can start a great career with some of those programs, even down to the AA degree level. You get started, then you continue on and take other stuff, right?
Oh yeah, yeah, no doubt. And of course, learning is a lifelong path for our students, and we want to make sure that is inoculated in what they do. And of course, social justice. We want to make sure that social justice is in the forefront of their practice, not just be the healthcare practitioners, but actually have a mandate to serve those traditionally under-resourced communities.
That's what you're
And
probably really hoping.
oh
We
yeah,
both really hope that happens. And I think you're right. I think if they go live here and go to that school, you know that the chances of them working here are very high.
yeah, and if not here, in other traditionally under-resourced communities, because some people again may move out of the area, and that's one of the benefits, of course, of being a healthcare practitioner, is wherever you go, they will need your professional services. So for those who choose to move outside of our area and work in some other underserved, under-resourced communities, that's beautiful as well. We're trying to make sure that we have a regional, national, and even global impact. We've had our international affairs department and some of our PA students recently traveled to Zambia in Africa, and there's an HIV AIDS
Oh,
center
nice,
there.
nice.
Yeah, so we're trying to make sure that we're covering the full spectrum of healthcare wherever it may be.
Yeah, I'm just a real admirer of from afar of Dr. Carlisle. I wonder if you could just say a few words about him. I think he's an asset to that school, and Bishop loves him to death. You know,
Yeah.
Bishop just stepped down, but he's a
Okay.
big
Nice.
part of what we're doing here, and he always will be. His legacy, and his son now is running things there,
Nice.
and we love him so much. You know, Charles is a wonderful Pastor Charles.
Beautiful.
But talk about Dr. Carlisle for a minute, just for a second. What's it like, and what's he's brought to the university, et cetera.
Under Dr. Carlisle's leadership, our university has grown, and it's continuing to grow, and that's one of the benefits of having someone like him at our university and leading our university. We did not have the School of Nursing as it is right now prior to
Correct.
him in here. We did not have the PA program at the master's degree level. We did not have the our own standalone medical school. So we have grown under his leadership. He's very personable. He, of course, came from Sacramento, the state of California,
Right.
working in that area. And now with uh, his leadership, he has forged connections with people such as uh, uh, Bishop Blake, and he has made sure that he is a part of the community and that we as a university are a part of the community. So we're kind of like following by his example. And I think that's really important. Some people say, do as I say, not as I do. He says, do as I say, because that's what I'm doing also. And that's, unique as a leader.
That's wonderful. I just want to tell you as we finish here that you've changed your information and everything you told a couple of my students that have gone over there. I think 3 or 4 now. You got 2 of them doing radiology. Go on ahead. You've changed their lives a totally a different arc than it would have been on. And you got them thinking about being doctors. That's crazy. They actually want to now go and do that. I will tell them about this and see how
Beautiful.
they're doing. So we really appreciate you. And I really want to double down this year on giving our 12th graders real alternatives for career and our students that are already degreed who are maybe doing policy but want to get to working with clients and customers and want to get into that, to get a hold of Charles Drew as a part of their decision making.
Well,
Uh,
yeah. And I appreciate that because a lot of folks aren't familiar with Charles University. So if we just have the opportunity to share what we're doing on behalf of our community, I think that's very compelling and within our community. So we're not some kind of outside force trying to make a change within a strange community. We're right there in the community in the Watts Willowbrook area of Los Angeles, California. And that's the area that we're trying to focus on, and areas like that outside of uh, the area that we exist.
all right, well, I want to really thank you, Laurell. I'm glad to know you, man. And we'll really be in touch early in the year to do some things. We're moving into that Family Life Center
Mm,
behind we're building it behind our cathedral. No
nice.
longer in the youth center anymore. There's a building
Okay.
being built there. You'll be shocked if you drive by. But we're
Okay.
across the street temporarily. But we're going
Okay.
to move in down there late in the year next year. And you're a big part of our thinking for being more a community involved church. We want to really take that to another level. And you and a couple other partners is all we're going to need to do that. We got some things going with trade tech that we're hoping to
Nice.
develop. But Charles Drew is going to be a huge part of it. And I want to thank you very much for doing this interview today. And you'll be hearing from us real soon, man.
Deacon Wilson, it's always a pleasure. I mean, you're such good people, and I know you have the community and our people at heart, and I truly appreciate that. It's not just a profession to you; it's a personal passion, I believe, to you, as it is to me. So I think we're in sync with that, and I think that's a reason that you and I work so well together, and have a good energy together because we're about serving our people.
Yes, sir. Thank you there, Laurel. Appreciate you.
Thank you, Deacon Wilson. You take care, be well, and I'll look forward to contacting you later on.
Bye bye now.
Bye bye now.